Yep. Good afternoon. My name is Hossein Afsali. I'm associate professor in health economics. So my area of expertise is economic evaluation and health economics. And I'm also coordinator for all postgraduate public health teaching programs. And welcome to Flinders Uni and public health teaching programs. I think we have 6 students, 6. And before I'm just trying to find my slide. Okay, just give me 1 second to share with you. Before I start, is there any question, anything that you want to share with us?
I think I might share, Hussein, that my name's Kelly and I'm the enrolments and course advisor for this course. There are 2 of us that work in the college, but I'm joining you today. So if you do have any questions around enrolment or course advice, I'm here, and I'm happy for you to stay online after this session if you want to have a chat.
Great. Thank you, Kelly. Thank you. Yeah, we have a fantastic student admin support team here at Flinders, and I was working with almost all of members of this team, and they are 100% supportive. And if you have any questions or anything about the course, of course, about the study plan, I can help you. But anything about, especially in terms of enrollment issues, definitely you can contact Kelly and the SAS team. Okay, so let's start the information session. As you know, the aim of this session is just to provide you with kind of high-level information about public health and postgraduate public health teaching programs. And when I say postgraduate public health teaching programs, I'm referring to technically 3 degrees: Master of Public Health, Graduate Certificate in Public Health, and Graduate Certificate in Health Promotion. And as I said, I don't go through the details about the specific topics. This is just a high-level information about the course, about the program, about the structure, and some issues around public health. Okay, and this is about orientation week, which started the 17th of July until 21st of July. But before starting and before talking about the course, I would like to acknowledge the traditional owners and custodians of the lands on which Flinders Uni campuses are located, and we honor their elders past, present, and emerging. Okay, I've got one small activity for you. So can one of you briefly explain, please introduce yourself, and then briefly explain why you chose this course, MPH or Graduate Certificate in Public Health or Graduate Certificate in Health Promotion, at Flinders Uni. Who wants to share experience or their choice or preference, please? Anyone? Dennis, would you be able to talk about this quickly? No, it seems that anybody, please? Okay. So it seems that, Kenneth, that's great. Please. You are on mute. Still, we can't hear you. Yeah.
Good afternoon.
Yeah, we can hear you. Thanks, Kenneth. Go ahead.
My name is Kenneth. I'm from Nigeria. So I had my undergraduate degree in pharmacy. So I decided to study public health at Flinders University because of close relationship with public health has my previous course of study. Okay, because I studied about the public health pharmacy. You know that when it comes to healthcare, drug administration, and the adequate use of drugs is also a thing of public health concern. So then I take a look at the course for the public health at Flinders University, and it gave exactly what I wanted. So I decided to do it.
Yeah, I think there are some connectivity issues, Kenneth, so I can't hear clearly, but that's good about the public health concerns and why you are thinking about the health system as a broad term, especially how the public health interventions can significantly impact the health system. So thank you, Kenneth. Dennis?
I've just unmuted Dennis. Sorry, everyone is on mute and their camera is off as a default setting. So as each person puts up their hand, I can unmute them and allow them the option to speak. I'm terribly sorry.
No, that was
Hello.
a default. Okay, no, that's fine. Okay, thanks for clarification. Hello, Dennis, please.
Hello, it's Dennis here.
Yep.
I'm from Kenya, and we have a lot of issues with our public health. And the government recently decided to put it as one of the major pillars in achieving universal health care. So that was among the main reasons I chose to do the course. Right now, I'm a medical lab scientist working in a hospital. I'm still waiting for my visa. It has been a bit disappointing, and hope it comes very soon so that I can join you. Thank you.
Yeah. No, that's great, Dennis. Thank you. So you are still waiting for your visa, and you are not alone because there are. I think my latest figure shows that I think 14 or 15 other students still waiting. MPH students still waiting for visa, and hopefully everything. You get your visa by next week. Hopefully, that's our hope, Dennis.
Yes, thank you.
All right. Okay. Anybody else? Just please raise your hand and then. Okay. So I think that was good. Thank you, Kenneth and Dennis. It was good. I mean, just you mentioned a few issues regarding the significance of public health and why you have selected this course, and especially at Flinders Uni. So let me just again to share with no, it's yeah, just give me 1 second. Yeah, so let me talk about a little bit about the postgrad public health programs at Flinders. And again, it gives you some broad picture of the course and what you will learn over the next couple of years for those who enrolled in our MPH program, or over the next 6 months for those who enrolled in our graduate certificate programs. As a postgrad public health student, you are now member of an academic discipline. So I think it's important for you to have some information about the university structure, different colleges, and where we are as a College of Medicine and Public Health or public health discipline. At Flinders University, we have 6 colleges, and this is the list of these 6 colleges. And College of Medicine and Public Health, within which we have a public health discipline or group, is only one of the 6 colleges. So as you can see, we have a broad range of colleges with a broad range of expertise and interest, from business to education, arts, social sciences, and nursing, and as well as science and engineering. So this gives us, especially in terms of public health, it gives us some flexibility in the choice of option topics or elective topics. Because when I looked at courses and programs in other colleges, I could find actually some or many relevant elective topics, and now we included all this broad range of expertise in our public health program. So it would give you some flexibility if you have some interest, for example, in environmental health, which is offered by another college, or even some public health related nursing topics like public health nutrition. So again, it gives you this sort of a choice and flexibility, which is good in terms of selection of different areas within your study or within your program. Within the College of Medicine and Public Health, again, we have a broad range of health-related teaching programs, things like medicine, CBT, biotech, and paramedic science. And public health, as I mentioned before, is one of the teaching programs or discipline or group within the College of Medicine and Public Health. And this is just a especially for core topics over the next couple of years for MPH students. And I think the most important point here is that these people all have a research background as well, which is really good because they can apply their research skills in their teaching practice. And actually, lots of them have some projects doing now, which can be whose findings can be shared with you as a practical example of teaching. So that link between teaching and research is something that we really value in public health teaching programs. And usually we use lots of our projects or our colleagues' projects within our teaching in order to clarify, further clarify our teaching points, or even to give you some practical insight into public health program or public health concepts. So we have a broad range of expertise, including EPI, biostats, health promotion, indigenous health, as well as qualitative research methods and global health as well as evaluation, expertise in evaluation of public health intervention, which is really a really important topic within public health programs, and economic evaluation. I usually coordinate all economic evaluation topics within public health teaching programs. A little bit about public health, and I know that you possibly know about public health, and that's why you have selected this course at Flinders Uni. But according to World Health Organization, WHO, public health is the science of preventing disease and prolonging life, and especially promoting health. So these three elements, how we can prevent disease, and when I say, or they say, prevent disease, so we need to look at all factors which can influence disease progression or even catching a disease. So that's one of the key elements of our public health teaching programs here at Flinders. So we look at all factors like social factors, even political factors, economic factors, which can influence disease progression. And then by preventing disease, we expect to prolong life. How we measure this is one of the key elements of our public health teaching programs. So there are different indicators to measure life, to measure quality of life, and to measure some probably disease-specific outcomes. So we over the next couple of years, we will talk about all these indicators and how to analyze these indicators, how to interpret, and how to report all these outcome measures or performance indicators. And the third element is promoting health, which is about health promotion. So as you know, we do have a health promotion topic, which is one of the core topics, but these health promotion concepts will be thought and discussed across more than one topic. So we have 3 or 4 topics in which we actively discuss health promotion, and of course talking and discussing from different angles. But what's the aim? The aim of all this public health practice is to improve population health. And when I say improve, some people prefer to say to maximize population health. So as you can see, I'm talking about population level. So I'm not talking about, or the aim is not improving health at individual level. And that is that's the difference between public health practice or public health practitioner and medical practitioners looking at the same concept, which is health, but at different level. Public health practitioners look at health at population level, and a medical practitioner, a GP, a general practitioner monitors health, but at the individual level. And that's a big difference between these two broad areas of public health and medicine. And the second element is equity. So how we can improve or increase equity, because sometimes maximization of population health is not necessarily in line with improving equity. So that's why we need to understand both concepts, and sometimes there is a trade-off between population health maximization and improving equity. So that's why over the next couple of years, especially within core topics, we will discuss the difference between these two concepts and what is the best way to maximize population health, and at the same time monitoring equity to make sure that we are not reducing equity at the population level. So again, these two elements, just remember these two elements. And over the next couple of years, definitely there are lots of topics and subjects around these two big principles in public health. I usually use this slide when I talk about public health. And I think it's a really good slide to clarify a few issues, especially the difference between public health and medicine, as I mentioned before. So this is a kind of, we call it as the river of health. So we have upstream interventions around here, and then downstream interventions. And when I talk about downstream interventions, so I'm talking about actually medical practitioners, I'm talking about hospitals, I'm talking about clinics whose responsibility is to improve health at individual level. But as you can see, a public health practitioners, by developing, evaluating, and implementing public health policies and public health interventions, can change the direction of this river. How? For example, if you are a public health practitioner and then based on your expertise, you implement for example, a colorectal screening program at the national level. I don't know, for example, because some of you are international students, whether or not in your country and in your health system, colorectal screening program is a kind of publicly funded program, or individuals should pay for it because it significantly impacts access to this program. But here, for example, in Australia, and definitely this will be discussed within our topics, here in Australia for people over 50, it's free, so people get the kit and all information, and then it might be detected if somebody has colorectal cancer. So my point is that this is a kind of upstream intervention developed and implemented by a public health office or public health practitioners, but the impact would be on the downstream care, because if we have an effective public health intervention, in this case, colorectal cancer screening program, then we expect by early detection of colorectal cancer, we can reduce the number of complications related to colorectal cancer. We can reduce mortality, we can reduce hospital admissions due to colorectal cancer, and all these things can significantly impact the care provided by a medical practitioner or hospital, or even in a for example in a clinic or something like that. So I think that's a really good picture to think how your performance and your intervention as a public health practitioners can impact the whole system, the whole health system, as well as primary care and secondary care, which is the hospital services. Now, I think I now focus on public health programs at Flinders. So more specific information about public health programs at Flinders. I mentioned 3 points here. The first point is student-centered learning, or a student-centered approach. And this is one of the principles here in public health. What does that mean? It means that we always listen to students. We always provide support for students. And as evidence, we have two actually student rep this year. We have 2 student reps, and they actually communicate every 2 weeks or sometimes every week with me as a program coordinator, or through the email, or even meeting face-to-face meeting, and we talk about all issues raised by students about a specific topic, about the structure of the course. And for example, over the past couple of years, I had a good collaboration with the student rep, and especially about a specific topic, they provided me with lots of feedback, and then we took action in terms of, for example, revising the topic, revising the assessment activities. So I guess my point is that, and I definitely through the course website, I will introduce these two student reps, fantastic student reps with lots of experience in communication with the students. They are both international students, very passionate about what they do. So I would encourage you to be in touch with them if you have any concerns about course, about a specific topic, making sure that your voice will be heard. And that's one of the promises, our promises, and one of the key features of public health program at Flinders. The second point or distinctive element for public health program here at Flinders is, as I said, meeting industry needs. What does that mean? It means that over the past 3-4 years, we had extensive consultation with industry in order to get some knowledge and insight into what competencies they need. And then we try to use this to apply the knowledge and skills that we have in order to meet those needs by providing all the skills, all key skills that usually public health industry or public health organizations, they need here in Australia and internationally. So what's the impact? The impact is that, or the effect is that when you complete your program here at Flinders, you will be ready to start your job because you already got all the skills, key skills and competency, public health competency that you need, because our topics align with industry needs. So that's our second feature, key feature of public health programs, postgrad public health programs. The third one is almost for all lectures. Usually we don't have, for each topic, we don't have just a lecture alone session. So we have lectures complemented by or followed by some sort of practical session. And when I say practical session, depending on the nature of the topic, it can be tutorial, it can be group discussion, it can be practical session. For example, for biostat, as we expect, after each lecture, we have a computer practical or computer lab, which is a kind of practical session. Or for economic evaluation, we have practical session. For qualitative research methods topic, we have some tutorial and focus group discussion. So again, the aim is to improve your knowledge and practical skills. So focusing on practical skills is again one of the key features of our public health teaching program. So that's three key issues that we follow, and you can feel all this principle over the next couple of years. And again, if you have any problem or difficulty in terms of these three principles, you can first, I would encourage you to talk with your student rep, and definitely the next step, I will be available to meet, to talk with you, and even meet with you if needed. Okay, so we have 3 degrees, as I mentioned before, and this is a big program. Postgraduate public health teaching programs is a big course or program at Flinders University. Just to show you some figure in 2022, because still we haven't finished this year, so it's still just the first semester figure. So I just focus on 2022. We had 320 students with almost 200 new students. So 200, and out of these 200 new students, 120 MPH students. So we have a big course or big program with big number of especially new students. And this year we had about 60. So far we have 65 international students. So a big cohort of international students. So that's good for international students because they can easily talk with other people probably from the same country. But again, my recommendation is that try to blend, try to talk with local students, try to get different perspectives from different students, even from different countries. So that's that would be a good, I think, great actually, learning process for you. So it's not just about the study, and of course that's the main aim, but at the same time you can improve your communication skills, you can improve your knowledge, you can improve your skills in terms of communicating with students from other countries or local students here in Adelaide or in Australia, because we have some students also coming from a different state, sometimes joining online, sometimes here. So that would be again a good learning process for all, especially for all international students. And yeah, so that's postgrad public health. We have a course flow site, and I think you should be, when you enroll, you should be automatically enrolled in this course site as well. So within this course site, so it's not topic site, it's a program flow site. You get all information about the course, including the program structure, capstone topics, recommended pathway. Still, you can consult with our SAS team about the recommended pathway, but everything, all essential information is included in Postgraduate Public Health course website. And also I, every couple of weeks, if needed, I make an announcement if some information that I think it should be circulated to all students, to all public health students, and even some events, for example, for public health students, or even job opportunities for those who are going to complete, for example, in a couple of months. I will usually make an announcement, and that's a really good and reliable source of information. So please make sure that you have access to this postgrad public health course website. If not, please let me know, and then we can fix this issue, because as I said, all important announcement coming through this course website. Okay, more specifically, we have two MPH programs. One is 2 years with 72 units, and the second one is 1.5 years. Of course, the admission requirements are different. And then we have graduate certificate in public health, 18 units, and graduate certificate in health promotion, 18 units. And I provided the website that you can, if you need more information, you can get some information from this course website as well. A couple of points. Most topics within our public health programs are 4.5 unit topics. We only have one 9-unit topics and then all other topics are 4.5 unit topics. So it means that if you are full-time, you can complete 18 units of study, which means 4 topics per semester. 4 topics per semester, which is 4 times 4.5, which is 18 units of study. Another point that I mentioned here is the mode of delivery. All public health topics can be or is delivered in hybrid modes. What does that mean? It means that it's appropriate for online students, those who enroll in the online mode, as well as in person. So we have some, in most cases, in most topics and most sessions, teaching sessions, we have a in-person session, and then all the sessions with tutorial or including lecture and tutorial sessions will be recorded for those who want to watch the lecture after that. At the same time, online students can join us and also contribute to the discussion. So that's the meaning of hybrid modes. And each topic has a study guide. Each topic has a site, a topic site, Canvas topic site, and I'm quite sure you have access, those who enroll have access to this topic site. And within the topic site, you can find, and that's, again, I encourage you, that would be probably the first step or first action. You need to look at the topic flow site, and within the topic flow site, you can find study guide or topic guide. And this is really important because for each topic, when you read a study guide or topic guide, you can find lots of information about the timetable, about the assessment activities, about the due dates, about the lectures, the content of the topic, lectures, and tutorial. So I think that would be your first step, to have a look at study guide or topic guide. Just a couple of points about core and option topics within postgraduate public health teaching programs. So as I mentioned, we look at or we consulted with our industry partners. So the core topics that we have usually covers 4 areas across 9 topics, 8 to 9 topics. The first one is how to identify a health problem, which is a kind of needs assessment. So to develop a public health intervention or any type of intervention, the first step is to understand about need. So that's something that we call it as a needs assessment process. And within this process, needs assessment process, you need to be familiar with and understand the key issues influencing public health problem, as I said before, including social factors, economic factors, political factors. And we have a few topics talking about needs assessment and factors influencing public health problem. The second one is the second theme covered within our core topics is how to develop a solution. When you find a problem and factors influencing the problem, of course, the next step is how to develop a solution to deal and address that public health problem. And this also includes critical analysis of existing policy. So if there is any existing policy, why it doesn't work, or if there is any evidence that you can critically review the evidence in order to identify the gaps within the existing solution and hence develop a new solution. Also within this principle, you can learn about research methods, which is, of course, the key or primary tool to generate new evidence or new policy. So that's why we have a few qualitative topics. We have a few biostat topic, epidemiology topic at both introductory and advanced level. Introductory level is a core topic, so you must complete the core topic because this is one of the core public health competency. But advanced topics are option topics or elective topics. For example, we have advanced epidemiology, we have advanced biostat. So if you are interested in more details about, for example, biostat or epi, you have this choice. You can select advanced biostat and advanced epidemiology, but as I said, it's not compulsory, it's not a core, it's an option topic. The third theme that we cover is evaluation. So again, we talk about how, when you develop your public health intervention, how to evaluate its effectiveness, and within the economic evaluation, how to evaluate or assess the cost effectiveness of the intervention. And finally, in terms of leadership, one of the key competencies is leadership in public health. So there are some professional practice and leadership skills in public health that you need to learn. And this is a focus of a couple of our topics or core topics. So that's 4 themes are covered within the core topics, our core topics. And then we have a range of, as I mentioned before, elective or option topics. And these are some examples. In terms of chronic condition, some students might be interested in chronic condition management or nutrition, public health nutrition, aged care, environmental health, public health toxicology, health ethics is a very popular option topics within for MPH students. And then we recently developed a new topic, an important topic, which is digital health. Lots of practical examples about how to develop app, and especially how to not necessarily develop, how to use apps in order to inform clinical practice or how to monitor health status. So it's a really good option topic. And we have a couple of more advanced topics like machine learning, again, for those who are interested in advanced biostat and data analysis. And I have to say that there might be some option topics which may not be available in 2023. So make sure that you can ask me or the SaaS team about the availability of all option topics. But I can promise almost the majority of option topics will be available in 2023 and 2024. And this is just a sample or an example of MPH structure for 2 years program. This is just a 2-year program. So again, within the core topics, so 3 components. We have some core topics, we have some major topic, which is called capstone topic, and we have some elective topic, as I mentioned before. So again, we have 2 streams or 2 types or brands of MPH coursework, and the difference, so the core topics are the same, but the difference is in major topic or capstone topic. In the coursework and research stream, we have public health dissertation, and of course is a research-based topic. It's very similar to PhD, so a small scale PhD, but just for those who are interested in research. So it's not compulsory. Still, you can choose the first stream, which is practicum in public health. And again, within this stream, we have 2 branches, and I will talk about these 2 as well in a minute. So capstone topic, you can choose. First of all, you are not eligible now, but the reason that I'm talking about, because you need to complete, for example, for 2-year program, you need to complete 54 units. But the reason to talk about this now is that because if you have to think about the pathway that you are going to choose, because it may impact the number of units that you can select. For example, if you choose PHCA 9509 as a capstone topic, which includes some sort of industry placement or educational based pathway, after you finish your 54 units, you can ask the topic coordinator, and I will provide more information. You can ask the topic coordinator in terms of whether or not you provide your expression of interest form, whether or not you are interested in industry placement. We have a limited number of industry placement available. Is a good option for those, again, those students who are interested to gain some practical knowledge and skills within industry or industry partners here. And we have quite a few industry partners like Cancer Council, Heart Foundation, Diabetes SA, working on different areas. But for those who are interested in dissertation, and again, I have to highlight this point that this is usually for those who are interested in research and they want to continue their study, for example, doing PhD after MPH. And so this is not an option for all the students. And again, it's not compulsory. You can choose your pathway. But for those who are interested, there is a possibility of doing public health dissertation. So again, if you enrolled in 2-year program, you need to complete 54 units first in order to be eligible for this topic. And it's a research-based topic, and we assign supervisor, and then you are doing a research, of course, based on what you've learned over the past couple of years. And we have a range of research areas, and we can specify your interest and how we can align your interest with the research area that are available here at Flinders. And graduate certificate as the second degree in postgrad public health is a 6-month program, 18 units. And if you are enrolled in graduate certificate in public health, this is the structure. So you have to choose 9 units from this list, the first list, which are core topics. Only 2 topics can be selected. And then there are a range of option topics. You can visit the website for the full list of option topics. Those who enrolled in graduate certificate in health promotion, of course, health promotion topic would be a core, and then 4.5 units from second list, and again 9 units from the list of option topics. There are some potential employers. So what happens after you finish your degree, MPH or graduate certificate? There is a range of potential employers in Australia, and I know each country may have different structure in the health system, which and different employers, of course, potential employers for public health practitioners. But here in Australia, we have Department of Health, Primary Health Network, Cancer Community Organization, public health community organizations like Cancer Council, or even research institutes and centers, and aged care sector. These are potential employer for, these are just important examples. The list is more than this. And potential jobs is, for example, again, a few examples: public health research officer, project manager, and the leadership topic definitely helps you to gain these skills. Epidemiologist, again, we have, as I said, introductory topic, core topic in both epi and biostat for those who are interested, and definitely it gives you some skills as a data analyst or epidemiologist. Community health officers, health promotion officer, and clinical study coordinator. And finally, if you want to continue your study as a PhD, there is a choice. And of course, I understand this is lots of information and you don't need to digest all these things now. But when you, I mean, in a couple of months, when you settle down, then if there is, this is a good resource, so you can get back to this recorded information session. And if you have more information, definitely I'm more than happy to provide more advice if you need. And the final point is about academic integrity. And that is really, really important, especially for international students. And when I say international student, because you are coming from a different educational system, and we appreciate this. We know that different countries may have different educational system and different requirement, but for any reason you have selected this course at Flinders in Australia, and then you have to make sure that you know the rules and the policies, especially around academic integrity. And I provided, there is a big list, but I provided a couple of examples here. Work or ideas directly copied from someone else's work, or even purchasing or accepting work done by others and presenting for assessment. These are a few examples. And this sort of breaching academic integrity will be detected by, we have a couple of systems here. And because I know that that most of you is a matter of misunderstanding. So that's why I'm trying to make sure that you understand. I think it's really, really important. Please visit this website. There is a information. There are lots of information, including a video about academic integrity. There are lots of policies. Again, I'm not asking you to read everything now, but that would be one of your priority when you start any topic here. And then topic coordinators are the best resources. So when you start, if you are not sure whether or not you are breaching academic integrity, as I told you before, I do believe that most of academic integrity breaching is because of misunderstanding, especially when you start your program here at Flinders. So just to minimize this risk, please talk with your topic coordinators, and definitely they are more than happy to talk with you. And if you have any issues, you can also contact me, or in each college we have academic integrity officers. We can provide all the information, their contact details, and then you can read the policy and contact us if still there are something that you need more clarification or you need more information. But that's a really important issue, and it's taken very seriously here at Flinders. And this is my last slide. So again, if you have question about enrollment, credit transfer, leave request, this sort of thing, please contact Ask Flinders. And Kylie may provide more information about this. But if you have some questions about the course, especially about the structure, you are not clear about the structure or study plan, you are thinking about the research pathway or doing PhD, this sort of questions which may impact your study plan, again, I can be contacted, and this is my phone number and email as your course or program coordinator. And there are, at the end of this slide, there are lots of slides I'll include it in terms of, just steps for enrollment and register. Definitely we upload these slides, and then you can also have a look at this information. Lots of information about enrollment that I don't need to talk about this. Okay, thank you for listening. And then I just stop sharing. And any question? Again, I know lots of information, but I think you can use this as a resource. And then again, watch the lecture, watch the information session and review the slides. And if you have any other question, definitely you can contact us. Kelly, what's the next step? Is just the questions, is that correct?
I'm hoping, can you hear me?
Yes.
Excellent. I had to change rooms because we have 3 students here in the Horseshoe seminar room in the medical centre. So we just had one question about how to enrol. So I'm going to stay and have a chat to the student about that. I'm just checking if there's any other questions. Nothing. And if anyone's got any online, if you could put your hand up, I'll have to unmute you manually. And we'll give you a moment to do that.
Yep. Any question, guys? Any types of information that you need at this stage? Yeah, definitely we will have more question, but in the future, near future. But at this stage, if you have any question about the slides that I presented in terms of content, and I think Kelly, correct me if I'm wrong. So everything in terms of recommended pathway is quite clear for, should be clear for students, and
It
then
should
they,
be.
yeah.
But again, I was going to say that my recommendation is to don't fumble through, reach out and submit and ask Linda's request. Be very clear about what it is you're asking. No question is a silly question. We understand that it's challenging to navigate the processes and the programs at Flinders at times, especially when you're newer to the system. And that's what we're here for. So don't hesitate. No question is too big and no question is too small.
Exactly, yeah, and especially I mean, for international students, I think it is more challenging. New environment, new educational system, new city, new accommodation, and we all understand this. And I think again, you know that there is a international student service, ISS, so they have lots of resources that can help you. So if you haven't done before, please contact them as well. If you have, you need more information, general information, that would be okay. I think we got a
We do.
question. Yeah.
How often are the assessments?
How often? So I think it depends on the topic. So it differs topic by topic, but usually, as I said, uh, the first assessment, usually we have 3 to 4 assessment, usually 3 to 4 assessment activities for each topic. And then usually after the first assessment would be 3 weeks, 2 or 3 weeks after starting the semester, and usually it has a small weight, probably a kind of a multiple choice question or short answer question with 10% or 15% of total mark. And then after 3 or 4 weeks, probably in September or end of August, we have usually the second assessment activities. And then in October, mid-October to end of October or early November, again, depending on the topic, we have third and fourth assessment activities. That's a general picture that I can provide. But of course, as I said, it differs by topic. So each topic has its own timetable. And again, if you enroll in, for example, 4 topics as a full-time student, the best way would be think about and review all the assessment activities for all topics or 4 topics, making sure that you understand due dates. Sometimes due dates for 2 topic might be for a specific assessment activity, might be very close in a couple of days. So you have to make sure that you can effectively manage your time. So it's really important to start thinking about management of your time, especially for full-time students. When is the
next intake? So we operate on semesters. So there's semester 1 and semester 2. So if your visa is deferred, there may be options that you can work through with the international compliance team, the service team, with regards to beginning your studies online whilst you are remote. However, once you are here in Australia, you are required to attend in person a majority of your study. And we have a lot of support on campus for international students who are wanting to meet other international students or domestic students. And that information is in the slides that Hussein showed before, and that's up on campus in the hub. There's a lot of student reference points there's the student union, or the student, is it FUSA? I'm trying to remember all the acronyms because there are so many acronyms at Flinders. So don't worry if you get a little bit lost in the acronyms as well. But yeah, so semester to semester, if you don't make it in time for this semester, if you want to wait until you're here in Adelaide, then it would be semester 1 next year. I think you're on mute, Hussein, if you were saying.
Oh, sorry. I was just I was saying that FUSA is the Flinders Union Student Association.
Yes. Thank you. You think I'd remember this, hearing it several times this week. Oh,
Okay.
you enrolled in 4 topics, but your timetable only shows 3. Why is that? That's a great question. That's something that I can help you with. So if you want to submit an Ask Flinders request, because when I log off of here, I'll still see the chat, but it'll be easier if you can log an Ask Flinders request. And if you say, hi, Kelly in the college, can you please help me with my study plan? And then that'll come straight to me rather than going through a long process of going, like, it's a several-day process of going through Flinders Connect, but it will come straight to me and then I'll be able to assist you with that enrolment issue. Are there any other questions? I can see someone is typing.
Okay.
Or not. They changed their mind, isn't no. What about the study material? Where and how can we get it?
Yeah, all the study materials can be, should be in your flow, in the flow, in the topic flow site. So for each topic, as I mentioned, there is a flow site, and within flow site, you can find a study guide, you can find all the slides, for example, and sometimes weekly. So some topic coordinators release teaching materials every week, but you have to find all this information about a specific topic in their specific flow site. And Kelly, I think all the students who enrolled in topic, they should have access to flow site. Is that correct?
Yes, 1 week before the semester starts, I believe is what they've decided for this semester, purely for the fact of rolling out Canvas. There may be a few little hiccups as you go through the transition from Flow to Canvas. We are all learning as we go through this. So any tips the students come up with, please share them with everybody, because yeah, this will be a little learning curve for all of us. But you will have that 1 week before.
Yeah. So please have a look at your flow site. And for example, if you enroll in, for example, 4 topics, you should have access, hopefully, you should have access to all 4 topics flow site. And as I said, within a flow site, you can find, especially start with the study guide. That's really important. Start with the topic guide, in which you can find lots of information, lots of important information about the topic, about the assessment activities, about the due dates. And then every week, the topic coordinator provides probably provides all the lecture slides and tutorial instructions or workshop instructions. So that would be kind of week by week.
We've also, Kenneth has his hand up. Kenneth, you should be able to unmute yourself, hopefully, or if you'd like to type your question in the chat.
Okay, so I want to understand something. For students that are still offshore waiting on their visa, is it advisable to enroll or just to wait until the visa is out?
That is an individual question. It really depends on whether you'd like to start your study possibly part-time and online, knowing that you're taking that risk of your visa being approved. If you'd rather wait until your visa is approved, and if you do miss the cutoff, then you will have to wait and start your studies in semester 1. But again, if you're happy to, you can submit an Ask Linda's request. If you address it to me and say it's about your study plan, and then put in your comments that it's also about obtaining your visa, I can talk to the compliance team in the international office, and they can have a look into what the options might be, and when you apply, they have a better idea of how long it may take for you to get an answer about your application. Does that answer your question, Kenneth?
Yes, that's fine. Thank you.
Excellent. Thank you.
Okay.
Are there any other questions? I've just put a link in the chat to the Flinders Handbook, which goes directly to the Master of Public Health 2-year study plan page, this course page. So you'll be able to see on there the topic outlines. If you want some more information about how to find your way around the handbook, I'm happy to take you through that. But there's also an MPHA for those that are studying the 1.5-year course. But that's where you can find all your topic information as well. If you click on the topics or search for the topics, you can find everything out there. Census dates, last day to withdraw without fail, the whole lot.
Yeah, this is about just general information about topics,
Yes.
topic overview, topic learning outcomes, and some sort of just insight into assessment activities, but not in details. So, but all these details can be found in the flow site, topic flow site.
Yeah.
Yep.
And looks like Dennis is typing something. I've just seen my Canvas page, yay! And the 4 topics I enrolled in are already populated. I'm still offshore though, that's okay. Your location won't change even though you have access to Canvas. You'll still get access because you have an enrollment pending, because you've been accepted into the course. As things change, depending on whether you make it here for the semester or not, then your access will change to Canvas as well. And that will generally happen around census date, I believe.
But that's a good sign you have access to all 4 topics.
I know.
It shows the system is working. Okay.
Kenneth dropped out, but he's back. Dennis is typing something else, I think. Three topics in the timetable though. That's okay, Dennis. If you still put through the Ask Linda's request, I will pick that up and I'll have a look, because that'll give me your student ID. So when you put through an Ask Linda's request, we require your student ID so that we can track all the queries that you've had, and also so to ensure that I'm looking at the right details and not another Dennis that might be enrolled in the same or similar course, which has been known to happen. You're welcome. And I think that looks like it could be it.
Yeah, that's great. Okay. As I said before, if you have more, when you watch this information session again and look at the flow site, topic flow sites, and read other information, if you have you need any other information about the plan, your study plan, structure of the course, I'm more than happy to talk about this. Okay, thank you.
Thank you. I will stop the recording now and